Hello, everyone. My name is Wael Abdelkader, and I'll be presenting our systematic review on the efficacy and safety of Tanezumab, an anti-nerve growth factor antibody, in the treatment of low back pain. Our agenda for today, we will go over some background content regarding low back pain, anti-growth factor inhibitors, and the burden of low back pain, our objective of the review, the methods we used, the results, and the summary of our evidence, some of the review limitations, and we'll finish with a conclusion and the summary statements. First off, low back pain, probably we all experience it. It is pain, muscle tension, stiffness confined below the costal margin, and it can be in two categories. It can be associated with radiating pain to the leg or the proximal leg. And there are two categories of low back pain. It's either specific low back pain, which is attributed to a specific pathophysiological reason, for example, rheumatoid arthritis, tumor, fractured trauma, or ankylosing spondylitis. And it is not, or maybe non-specific when it cannot be attributed to any cause. And by far, non-specific low back pain accounts for 90% of all low back pain patients. Low back pain is such a burden, and because it accounts about 7.5 global prevalence in 2017. The graph and the other on the right side of the screen presents years lived with disability, as low back pain is considered the #1 global cause of disability. In Canada spends around up to $12 billion on low back pain treatments per year, which is a lot. And for its management, there are multiple non-pharmacological versus pharmacological options. The non-pharmacological include exercises, CBT, massage, and manipulation therapy. And the pharmacological includes non-steroidals, opioids, muscle relaxants, and benzodiazepines. The most commonly prescribed medications are the non-steroidals and the opioid medications. However, they are not well tolerated, and a recent because of the GIT side effects and etc. And also a recent systematic review concluded with moderate to high evidence that non-steroidals has only a low effect on, or a small effect in reducing the low back pain intensity. And this is where comes in new medications, and companies like Pfizer started working on a new medication such as the anti-NGF or the anti-nerve growth factors. Nerve growth factors are neurotrophic proteins essential to the differentiation and our development stage for the growth and differentiation of peripheral sympathetic and sensory neurons. And in adult life, it acts as a regulator for the pain receptors, as it binds to the tropomyosin receptor kinase and regulates the neurotransmitter release in the situations of pain. Anti-nerve growth factors such as Tanezumab, leronlimab, and Fasinumab binds to the nerve growth factor and inhibits its binding and reduces the pain. However, this was discovered or started experimentation early in 2010 or 2010, but the Food and Drug Administration have halted clinical trial for Tanezumab because some of the patients experienced accelerated or more progressive arthritis and needed an early date for their joint replacement surgery. In 2015, the FDA resumed phase 3 trials for Tanezumab. So the purpose of this review is to study whether Tanezumab, and why Tanezumab, because it is the most advanced in clinical trials in comparison to the other anti-NGFs. So Tanezumab is to study whether Tanezumab is associated with the reduction in low back pain intensity or reduction in functional disability, as well as its tolerability and the adverse events comparison to placebo and non-steroidal anti-inflammatory in adults diagnosed with non-specific low back pain. To answer this question, we conducted a systematic review in which we systematically searched 6 databases: Central, Medline, Embase, SciInfo, Senehil, and Web of Science, using a combination of terms to cover low back pain, and monoclonal antibodies concepts. We included studies that recruited participants with non-specific low back pain without radiculopathy, which diagnosed according to the Action ADS pain taxonomy, or the American Association of Pain Society of Pain taxonomy, to be without neurological symptoms, non-specific low back pain with at least 3 months. Included any dosage of Tanezumab, any route, any duration, comparison to placebo, non-steroidals, and included only RCTs, since there is no observational studies for the drug, as it is not yet released in the market. We included outcomes of improved to represent improved low back pain, and measured by low back pain intensity questionnaire and the patient global assessment of low back pain. And the functional disability was assessed by the Roland Morris Disability Questionnaire, and the safety and tolerability was assessed by the rate of any adverse events, serious events, and treatment discontinuation. Risk of bias, we used the Concurrent risk of bias assessment tool to assess the 5 domains of risk of bias, and we summarized the evidence using GRADE, and we reached the assessed the quality of evidence using the GRADE summarized via the GRADE Pro software. Here comes our results. Our search strategy retrieved around 1,700 records, of which 44 records were included in our full text analysis, and 4 studies met our eligibility criteria. Our risk of bias assessment tool, we used the risk of bias assessment tool but for the RCTs, and the 3 out of 4 studies were downgraded for high risk of bias regarding missing outcome data. For example, because there was less than 25% continuation in their population without proper explanation, or the explanations was attributed to the medication or the intervention. For example, the Markman study, they reported a 23% and 65% discontinuation rate at 16 and 56 weeks respectively. And it won't be a meta-analysis presentation without a bunch of forest plots. The first forest plots we have is the Tanezumab versus placebo and pain relief efficacy, assessed by the low back pain intensity score. As we can see here, that Tanezumab exhibits is superior to placebo and presents a small effect, and this was based on the standard mean difference using the Cohen's threshold rule of thumb. And for the functional disability as well, we have a small effect, which is more precise in comparison to the low back pain intensity or the pain relief efficacy, as we're going to see in a bit. And in comparison to non-steroidals, again, Tanezumab was superior to placebo. However, it was clinically irrelevant effect. In comparison for Tanezumab safety in comparison to the placebo, we can see that Tanezumab results in an increased risk in comparison to placebo. And for the serious adverse events, we can see that there is no difference. But however, this can be attributed to the very low total events rate. And finally, we compared Tanezumab 5 milligrams to 10 milligrams, as the studies included multiple dosage of Tanezumab. And we can see that Tanezumab 5 milligrams is associated with less any adverse events rate or fewer adverse events rate in comparison to the 10 milligram dosage. To summarize this in terms of quality of evidence, we can see that here we have a only one moderate certainty that Tanezumab reduces functional disability in comparison to placebo. And the rest were downgraded because of the missing outcome bias, and the confidence interval crosses the point of small effect. And for the safety summary, we have only one moderate as well for the effect or for the any adverse events. And this for the any adverse events, the rest were rated down for the missing outcome bias, for the confidence interval crosses the point of no difference, or crosses the point of no difference and the point of harm in the situation of any adverse events in comparison to non-steroidal anti-inflammatory drugs. Our review was limited by the number of included RCTs. How this made it unapplicable to use a funnel blot to assess the publication bias, although the search was pretty exhaustive and inclusive. Another thing that all included studies reported a high risk, was reported to be 3 out of 4 was reported a high risk of missing outcome data. And finally, all included studies were sponsored by the producer of the drug, which is Pfizer, which raises a potential bias. And finally, we like to conclude that with moderate certainty of evidence, Tanezumab is likely to result in slight reduction in low back pain functional disability, and likely to result in little clinically irrelevant increase in the rate of adverse events compared to placebo. And with low certainty, Tanezumab would probably reduce low back pain intensity slightly. And finally, with low certainty, Tanezumab is likely to result in little to no difference in reducing low back pain intensity and functional disability when compared to non-steroidals. And for future considerations, that this evidence was pulled from few number of clinical studies, and more RCTs is needed to properly evaluate the efficacy and safety of Tanezumab for low back pain patients. And thank you, and I'm happy to take your questions.